index, tabular list, all same only. 1 second, I will show that too. So this is the cover page, right? In cover page back we have this all numerical modifiers listed. This cover page back say they listed all modifiers. If anything want, you can come these pages and you can find out. Then we have the pictures. These pictures it will help to answer the anatomy questions. You can come this book and you can find out based on the picture you can answer. Then after that we have the alphabetic index. As usual, how we are searching CPT book or ICD book, like that only you have to search, and you have to, if you are getting any codes, you can check with the tabular list. Tabular list, this alphabetic index over, it is present. So here it is present. So any code, if you want to search, you can check with the alphabetic index, then you can come with the tabular list, you can come. Once this all tabular list over, then we have appendix A. So here only if you want to search any drug codes, you have to come with the based on the what exact drug, and you have to check the route, and it will show the one code. So once code it is showing, don't go here alone. You have to go with the, again you can go back with the tabular list. There you have to confirm which is the exact code. So here one code is there J0696. J0696. We will see that. Here administered 1 gram. If 1 gram administered, what is the code? J0696. J0696. 1 gram administered, how you will report?
J0 into 4.
Yes. Because
J0696 into 4.
One time if you are reporting, how much it is saying?
250.
250 mg.
So if you want to convert 1 gram, then you have to multiply into 4. Yes, like that you have to do. Then another one, that colonoscopy code we have. What is the code? G0121.
Sir, all codes are only for Medicare patient in HIPEX.
No, not like that, but mostly we'll use all codes for the G code and all we'll use for the Medicare. G code. G codes, whatever we have in the HCPCS book, the G codes we'll use for the Medicare patient. Okay. So here I mentioned G0121, it is for the colorectal screening. If not having any risk, this code. If they mention risk mention, then we have to go with the G0101, it will come. G0101. Sorry.
So it's the vice versa, right?
Yes, yes. So risk is present or not, we have to look. 0121. It is for the not having the risk. So how they are differentiating risk means based on patient is having any past cancer or any colon polyps or anything present, based on that they are using. If it is risk present, here one code is mentioned. Colonoscopy not high risk. What is the risk code then? With the high risk means what is the code?
G0121 is the high risk code, right?
121 is not meeting high risk. G0105. G0105 it is showing for the individual high risk.
High risk. Okay.
Yes, so you can look in this to anyone. Okay. So next code Q4110. Q4110. So it is, if they mention pre-matrix, you can go with based on the square centimeter. This is code. This is sometimes it is coming Q4110. Then next one is L0629. L0629 is the repeated one, custom fabricated. So this is the repeated one. Please remember, if you are seeing question custom fabricated, if anything done, you can go with this is the correct code L0629. It is the most repeated
Okay.
question. Please remember this. See custom fabricated L0629. Then sixth, seventh and all you can look. Then eighth one also same. Ninth one is if patient is having insurance, Blue Cross, BCPS insurance, that time that patient coming for the suture removal, you can use the code S0630. Removal of the suture by physician or other physician who originally closed wound. If we are looking at the question BCPS insurance, that time that patient coming for removal of suture, you can use this code. So this much only we have in this HCPCS. 5 question it will come. It is direct only, easiest question only. Not that much.
The one we didn't discuss.
What?
CPC 100.
What?
Third question.
Third question.
CPC 100.
No, that is leave it. Simply like it. Not.
Okay.
Then so ICD. I will tell ICD answers. You can already noted, right? You want, you can cross check. Okay. Please give me. So first question, DM with ESRD, E11.22, N18.6. E11.22, N18.6. That is the first
Sir,
answer.
it would be E10.22, right? It's
Okay.
diabetes mellitus
Okay.
1.
E10.22, N18.6. Yes, that is correct. First one, E10.22, N18.6. That is the first one. Second one, the third degree burn in right hand. Third degree burn in right hand. That answer is T23.301A. That is the second question. T23.301. What?
The question was incomplete, so I gave
No, not an issue. That's why now I'm giving answer also. Question is right hand. Then answer is T23.301A. Then third one is facial palsy G51.0. Clear with this? Any doubt?
Yes, sir. No.
Okay. Then patient is having fracture and HIV. Reason for encounter is fracture. So first we have to code fracture, then
then
B20.
B20.
Yes. Then HIV with pneumonia. First we have to give the B20.
And then
B20.
pneumonia.
Yes, because all respiratory conditions related to the HIV. So B20 first, then J18.9. The next one, sixth one is if poisoning. So which one you will give first? Poisoning concept.
First poison.
First poisoning code.
The poison.
Yes.
What is causing the poison?
Yes, the T code is first. Then you have to give signs and symptoms. Correct?
Yes.
So
Yes.
here mushroom poisoning means sixth one. T62.0x1A.
Yes, sir.
And symptoms code. If it is suppose nausea, vomiting and all it is there, you have to give separately. T62.0x only. Okay. Then opioid withdrawal and dependence. F11 point. What is the code? Opioid withdrawal along with the
23.
dependence. Yes.
F11.23.
Yes. F11.23. Next one, Alzheimer dementia with wandering. So G30.9, comma F02 point. What is the code?
81.
Yes.
So
So
why G30.9?
Alzheimer dementia with, if you are going with F02.81, it is giving some instruction.
Okay.
So what is Z91.83?
No, that is with wandering. If,
Okay. Okay.
if it is there, you can give. Otherwise, don't use that. In exam, if they given Z code, you can use. Otherwise, don't give. First, you can go with the Z30, G30.9, then F02.81. After that, Z code present, you can use. Otherwise, no need. Okay.
Okay, sir.
Okay. Then next, appendicitis with peritonitis. Ninth one. What is the answer?
K3520.
No.
K35.33.
Yes. K35.33. K35.33 is the correct answer. Anyone having different answer? That is for the ninth one. Then fifth one, cholecystitis. So tenth one. Tenth one is cholecystitis with cholelithiasis. What is the code?
K80.10.
80.10. Yes, that is correct. Then, okay. Severe sepsis. The 11th question is severe sepsis with acute respiratory failure. What is the code? Severe sepsis with acute respiratory failure. Severe sepsis with acute respiratory failure. What is the code? You can tell.
A41.9,
Okay.
R65.20,
Okay.
and J96.00.
Yes. A41.9.
Yes.
A41.9, comma or 65 or 65.20, comma J96.00. So this is the answer for severe sepsis with acute respiratory failure. Clear with this? Any doubt? Then 12th one is here combo code hypertension CKD CHF I13.0, comma I50.9, comma N18.9. Here combo code all together.
Yes, sir.
Suppose if in exam that hypertension, sorry, CHF is not relating to the hypertension. What is the code then? Question they are given clearly. This heart failure is CHF is not relating to the hypertension. Then what is the answer?
I11
I20,
Correct. Repeat.
I12.9,
Okay,
N18,
I12.9,
N18.9, and then
N18,
I50.9.
okay, N18.9, then I50.9. Yes. If clearly the stating heart failure, congestive heart failure is not relating to the hypertension, first you have to take combo for the hypertension with CKD. That is I12.9, N18.9. After that, you have to give the congestive heart failure code I50.9. Okay.
and if
So
the CPC is not given, then
what?
only written hypertension, CKD, hypertension and heart failure then. But heart failure is not related with hypertension then. I10 and I50.
Yes.
Okay, sir.
If they are stating clearly it's not related, no, you don't go with the combo code. You not mention anything, then default you can take the combo. Okay. Then on 13th one is elevated blood pressure. That is elevated blood pressure. What is the code? Elevated blood pressure. Elevated
R03.0.
or 03.0. Yes. Elevated blood pressure, that is 13th one. Then 14th one, 15th one, leave it. 16th one, COPD with chronic bronchitis. COPD with chronic bronchitis.
J44.
J44.9. Yes. Then 17th one, COPD exacerbation with chronic bronchitis. J44.1. Then 18th one, 18th one is
S06.5X9A.
S06.5
0.5x1a.
X9A.
Unspecified one.
Yes.
Okay.
Yes, 06.5x9A is the correct answer for 18th one. Then 19th one, gestational diabetes mellitus, O24.419. Okay, O24.419. Next, brackets used in alphabetic index. What purpose we are using brackets? To find the what?
Manifestation codes in
Yes,
alphabetic and
yes. To find the manifestation codes. So that is the brackets used in the alphabetic index. Then 21, AIDS with pneumocystitis corneal pneumonia means B20 as first, then B59.
Yes, sir.
Then next, elevated blood pressure already we seen, that is 22 or 03.0. Then 22, 22 over 23, dermatitis due to ampicillin adverse effect. First we have to give the adverse effect code, correct? No, symptoms.
L20.
Symptoms code first.
Symptoms, sir. Yes.
L30.9,
L27
come on, T36.0 X5A.
X5a.
A.
So first we have to give the uh, symptoms code first, then adverse effect code. Okay. Then one more some questions. Hmm. Please search this codes alone. Acute appendicitis with generalized peritonitis. What is the code? Please search this. Acute appendicitis with generalized peritonitis. Acute appendicitis with generalized peritonitis. K53, K35.33.
K35. E35.20.
E35.20.
Yes, sir. It's K35.20.
E35.20.
20.
E35.20. Acute appendicitis with generalized peritonitis. Okay, without abscess. Okay, so K35.20, that is for acute
Sir,
appendicitis.
if generalized or localized is not mentioned, then what should we give as a default code?
Then unspecified anything is there.
Okay.
Like that. So here, without generalized peritonitis. So if here clearly mentioned acute appendicitis is generalized peritonitis, K35.20. Okay. Then COPD with moderate asthma. COPD with moderate asthma. What is the code? COPD with moderate.
J44.9 and J45.4.
Asthma with COPD, J44.9.
And J45.4.
So J44.9 is
COPD unspecified.
okay.
And J45.4 is moderate persistent asthma.
So separately we have to give.
Yes, because it's given. We have to code the type of asthma if applicable.
Okay. So but here they given in asthma with chronic.
So, sir, it is written, it includes asthma with COPD.
Which code?
Yes, but
J4.
it also says that code also the type of asthma.
Yes,
The
yes. Like
type of
clearly
asthma.
here they mention code also type of asthma if applicable. So what is the final code? J40.
So we'll give two codes, J44.9 and J45 point the which asthma, the type of asthma.
4. J45.4 moderate persistent asthma.
J45.4.
640. 4 is the initial code.
Okay. So it is acute. Okay. So we can go with 40, right?
Yes, sir.
Yes, sir.
So please look this question. It is coming while reporting in exam. Please check what is the appropriately it is coming. Okay. Okay. So this all some repeated question. What is mean by that systole? What is mean by diastole? Systole means what? When you will consider systole, when you will take diastole. I'm asking general this like anatomy. Anatomy question. Systole means what? Contraction
When
or relaxation?
contraction of ventricles,
Contraction. Contraction.
Contraction is what?
of ventricles, sir.
Okay, that is for what? Systole or diastole?
Systole,
Diastole means
relaxation.
okay. Okay. So that's all about. So that pedicus carpi for one question if it is coming, that is for the you can select penis organ related question. Pedicus carpi, any muscle it is coming, so it is related to the penis. Okay, that one you can remember. Then uh, impending myocardial infarction with unstable angina means I20.0. Only one code. Impending myocardial infarction with unstable angina means only one code, that is for I20.0. And this is the question. And which is the not part of the auditory system? That one I said it is the ciliary body. Ciliary body this comes under eye, so it won't come in the ear. So that question. Okay. So
So
that's
what
all
is the
about
part of penis you said caught by?
pedicus carpi. Pedicus This is related to the penis. So any question it is coming while doing, please check this. Okay. Then it's this much only. If any new question is coming, I will share that in WhatsApp. You can take that. You can do the practice also. Okay. So that's
Okay,
all.
sir.
That's all about that revision. So if any new question, if I got, I will share through WhatsApp.